Good evening and welcome administration, faculty, family, friends, and future nurses. My name is Nicole Moore, and I am truly honored to stand before you today as a fellow nursing graduate of the Maine nursing program. Throughout our journey together, we have shared countless hours of dedication, hard work, struggles, and triumph. This evening, we all gather to celebrate this momentous occasion of transitioning from nursing students to professional nurses. Let us all be reminded of the incredible privilege it is to become a part of such a compassionate and resilient profession. Tonight, we will be participating in the pinning of our nursing graduates. Pinning has been a celebrated tradition as early as the 12th century. Pinning has been closely tied to an award given to Florence Nightingale as early as the 12th century. Pinning has been closely tied to an award given, Let's repeat that. Pinning has been closely tied to an award given to Florence Nightingale, also known as the mother of modern nursing. She was awarded the Red Cross of St. George in 1860. Then in turn, Nightingale awarded her brightest students a similar award. For the graduating class this evening, this pin represents hours of incredible dedication to our studies and clinical experiences. People from all corners of life have come together in the unified thought of providing the best holistic care to the patient population. We have developed lifelong friendships as well as dried tears after challenging situations. We have also been cheerleaders and supporters of one another. I can personally say I could not have made it here today without all the friendships I've made within the program. Thank you for celebrating this special occasion of the pinning ceremony. Please give a warm welcome to the Dean of Nursing, Amy Goman.
Good afternoon. It is my very privilege to honor and to welcome all of you here today. As Nicole said, this is a long-standing tradition that goes back centuries to welcome you into the profession of nursing. I don't have a speech, I just have a welcome, okay? So this isn't going to be long in that I just want you to think back to your first day emotions of nursing school. How did you feel when you walked into that orientation, that room, you saw those people that you didn't know? Fear, anxiety, trepidation, excitement. You're finally here. You've waited a long time. Fast forward to your first POC in 2800 and a little bit more frustration and what am I supposed to be doing and do I really want to do this? To your last POC in 2900, excitement that I finally understand it, I've got it. You will feel all of those emotions as you also care for your clients. You will have the privilege of being in moments of great gladness, the birth of a child, great sadness at the loss of a child, great happiness on a successful surgery, sadness and sorrow with the diagnosis of cancer. There will be so many emotions. Please hold tight to those and know that all of those make you a better nurse. Your caring and compassionate nature will serve you well and make you connected with them. So tonight, as we celebrate and have happy emotions, I am so honored to welcome you, not only as an alumni now, but as a peer, our peer. No longer are we a student, administrator, or faculty relationship. It is a peer. So welcome and congratulations. Now we will hear from our faculty members, and we will start with our semester 3 faculty.
All right, welcome everybody. My name is Mary Sladek, and Lois and Monica will have a few moments here to visit with you. But I'm just speaking also on behalf of Jeannie Harstead and Elmira Terdelvia, and we also have Blair Vickerman and Tanya Villegas who are with us. So maybe some of you haven't seen them, but that is our team. And it's like, oh my gosh, as Amy had just said, remember when you guys first came, I was like, you guys are just like shaking. Wow. But now you guys are so cool, right? They're ready to go. You can just tell. It's always fun to be in the first semester of nursing, and we get these minds. They're minds, but you know what? Over the course of time, boy, do we see the thinking grow. And it's so cool just to see you guys in the hall. Because as a faculty who've seen you just at the beginning to now seeing you here, we just see tremendous growth. And you're ready. You know, you're ready to take care of patients, clients, families. So it's just so fun to see. And just so you know, as you probably have heard in the leadership class, whenever, it doesn't stop here, right? You're constantly learning and growing throughout your career. And so even as you are done here, your learning certainly does not stop, because you have to really prepare yourself for the NCLEX exam, right? So really, really work hard. They're going, oh my gosh. But what I can say is, like, the folks in the audience, we are so happy for your support of our graduates. Truly, if it wasn't for each of you, whether it's parents or spouses or kids, you know, I don't think our students would be as successful. So thank you so much. And I'm kind of like a chatty Cathy doll usually, right? So I'll just stop and let the others speak.
As Mary said, I'm Lois Mandler, and I've worked with them in lab and in the classroom. I remember those first days and weeks and how overwhelming this program can be, but they've survived. It's awesome to see you up here. I congratulate each and every one of you, and I'm so proud to have been part of your learning, even, you know, as little as I had to do with it maybe on some days, but certainly proud of you and your accomplishment and being here today. Congratulations.
My name is Monica Stanton, and I am very honored to be new this semester, and so I'm meeting everyone here this semester, and I just have to tell you, I am so very, very, very impressed, and I'm so proud in all that they do. Just watching them, it is just so impressive. I work with them in the lab, in the nursing lab, and I'm just nothing but impressed. And so I would love to congratulate each of you and wish you joy. Joy in your days. Some days might be a little harder than others, but there'll always be something that you can take away from it to bring you joy. So congratulations, everyone.
So good evening, everyone. We're the middle semester. We call it semester 4. And I'm one of the faculty. This group also, Mary Main. Mary, come on up here. Mary was also one of the faculty at our level for this semester of students. Okay. So she's sneaking up in her coat, and I'm hiding myself because I'm recouping from COVID. So I'm wearing my mask. I don't want anybody sick over the holidays. So, again, I think I told you I'm Lori Mountain. I want to also tell you that nursing students are taught to use an SBAR format, S-B-A-R, when they communicate. This helps to keep things clear, make sure that a physician or another provider or professional knows what's going on. In this, the S stands for situation, where the problem is described. The B is the background information. The A is the nurse's assessment of what's going on. And the R is the nurse's recommendation, or what they think they maybe need to do, or where they might need some orders. So I'm going to talk about the S, or the situation. Hello, hello. This is one of the nursing instructors at North Hennepin Community College, and I am calling about my concerns for the nursing students. They are exhibiting a variety of symptoms, including anxiety, sleep deprivation, and failure to participate in family and social activities. I am concerned.
So the students applied for the nursing program with no idea how much work would be involved. They faced early morning clinical and late night clinical prep, multiple challenging assignments, and perplexing exams. They report being completely overwhelmed, stressed, and exhausted. They have difficulty remembering their family members' names.
Assessment. The students are alert and oriented to person, place, and time. Vital signs are stable, but heart rates increase substantially when faced with an alert, all that apply question. They become diaphoretic and nauseated. We had to administer oxygen when we noticed signs of information overload, which occurred often after we altered assignments and due dates. The students' symptoms are steadily increasing with each APA assignment or theory exam. They seem to be unstable and may get worse. We need to do something now. My recommendation, can we get an order for some rest and nutrition prior to them taking the NCLEX? They also need some time off with their friends and their family. I also think we should transfer them out of North Hennepin Community College and into the healthcare fast stat, where they can experience the rewards of working as professional nurses while continuing their education in BSN program.
I don't have anything prepared, but I've got a pretty good story. Back in September, I got a text from someone who said, "Hey, 3/4 of our class just failed the first exam. Does that sound right to you?" And I replied, first I thought about it for a while. I thought, should I even reply to this? I don't want to really insert myself in this. But I said, well, my recollection is, and I actually looked at my old notes, is that 2/3 of you failed my first exam. So I guess that sounds about right. And then I explained the test evaluation situation, and I got a text back that said, that sounds really reasonable. Thank you for making sure that we do well on the test and we learn how to answer these questions correctly. So I appreciate that. I don't want to say who did it, but it was Raina. And it was a very appropriate, very polite text, and then she said, why don't you come to our pinning? So here I am. So thank you so much for that invitation.
So to the graduating class, our hearts are filled with joy with you. So from the 2,800 faculty, we wish you all the best as you travel the road of nursing. Welcome.
So you two didn't introduce yourselves.
Oh, I'm sorry.
Go up and say who you are.
I am Dorothy Ikegwani of the 2800 faculty.
And I'm Judy Cotter. I teach for the fourth semester in 2800, 2820, and 2850. So, thank you all.
Good evening. My name's Linda Carlion, and I'm in the 5th semester with Amy Peterson, and we have Desi Arneson that also teaches with us, and then we have some adjuncts, Miriam Osamar and Tanya. She was with semester 3 as well, and Cassie Kramer. Why aren't you up here? Oh, you're admiring. Oh, great. So tonight, we're being a little bit more serious with semester 5 here, but some thoughts. Sometimes people say, well, what do you get paid now that you're working as a nurse? Is that a good career to go into? And it can be. It isn't necessarily, though, but so we don't always get paid with money. Sometimes I get paid by holding your hand when it seems like you're upset with the world around you. Maybe scared about the procedure that's coming up. Sometimes I get paid when a baby takes its first breath after it's been born, and I've helped make that happen. Sometimes I get paid even though I have to get up at 5 o'clock in the morning and get to work early to make sure each one of my patients gets their medicines and their back rubs and their procedures and whatever. All of that happens on time. Patient education, very important. Sometimes I get paid, let's see, where is it here? To teach students, in this case, the complexity and the joys and the hardships of nursing. It's definitely a time-consuming job, and my family members will understand that to be a case for all of the teachers, actually. We spend a lot of time making the program work for you. But it is a profession that pays you. No matter where you work, no matter what you do, where you go, you get paid somehow. And we do make a difference in everybody's lives that we connect with, and they make a difference for us, which is why we stay in the profession.
Another instructor, Desi, isn't here in our team, 2900. She had something come up, so she's not here tonight. So Linda and I are representing. Students in classic Amy form, I'm not really sure what's going on here. I had to tell them many times throughout the semester, I am one of you. I am that person that's waiting till 11:59 to turn it in. Totally understand. So this is kind of one of those also. But first off, I want to say this is my first year teaching full time. So that has been a journey with all of us together. This group's been very polite with how sometimes they have to redirect me even, which I very much appreciate. But it's been an honor to teach all of you. It really has. Together we've had a lot of laughs. We've had some tears. I try not to, it just happens. But some tears. And most of all, you guys know your 2 F's that you're always gonna remember. I got close for that. What are they? Fires. What's the other one? Are you kidding? Take away all of their graduation. Fascia. Thank you. You're welcome. So, but know that I'm so proud of all of you, and I just want to echo what Amy kind of said, like, you're my peer now, and that's so fun, so I don't have to censor myself so much. But I hope that I will see all of you at the hospital or at Target, where I also go a lot, and still get to please catch up and email. Let me know how it's going. Thank you.
We have just some candid slides for those of you who came in late. We're going to show those quickly, some of the kind of fun things that happened during the semester.
Hello. As you can see, I was very excited, so I got up a little early. My name's Ebony, and I'm part of SNA. I'm the president here, and I'd want to welcome family, friends, and esteemed faculty to our pinning ceremony today. As president of the Nursing Student Association, I want to thank all of you for being here with us today. Today, we gather to celebrate this remarkable and endearing achievement that marks graduating nursing school. The journey started in last August of 2022, and I think I could speak for everybody here when I say we have not slept since then. We spent hundreds of hours mastering so many complex medical concepts, along with countless hours of clinical rotations. Together, we were honored to witness the beauty that is human life and the works of human resilience. We cared for patients during their moments of joy, triumphs, and times of heartache. Some of those that you see sitting up here behind me or beside me were fortunate enough to hold the hands of actively dying patients in their last moments and be of comfort and solace to their families when they needed it most. So as you can tell or hear, this journey was not only about accumulating knowledge, but it was also to discover our strengths within ourselves and master the ability to be dedicated and dependable in the face of adversity. We've become skilled in time management, multitasking schoolwork, clinicals, and our personal lives. This journey required tremendous sacrifice from all of you loved ones here today. I speak for all of my peers when I say that it does not go unnoticed. We missed so many sports events, movie dates, first words, and overall quality family time. We know that for some, this may have taken a toll on you. And us parents especially know here that our kids got sick and tired of hearing us say, "Sorry, sweetheart, mommy has to study. Maybe next time, I promise." Sorry, I'm getting a little emotional. Whew. Y'all know I feel this. Okay, the guilt we felt having to constantly repeat these words were immense because at certain points, it felt like it would never end. We want you to know that your love is what helped get us here. All of you fueled our determination to make it to the end. On behalf of our cohort, I would also like to thank our nursing faculty. Your wisdom helped shape and mold our understanding of what it takes to be a nurse. As we move forward into this chapter, we carry forth our nursing values of empathy, compassion, advocacy, and commitment to our nursing excellence. We are entering a field that is desperate for that is in desperate need of our help in a world that is destitute for healing. Big congratulations to us all. Today, we not only get pinned, but earn the privilege to make a massive difference in the lives of those that we serve. May our journey as nurses be as rewarding as the journey that brought us here to this moment, right here, right now. Thank you.
As the students, graduates, now come across for pinning, and those of you who will, friends and family who will be pinning, if you can line up with them over on that side. And while they are moving, I just want to say that if you were listening, you noticed a theme in all of those things, all of those moments that we spoke about. Everyone spoke about compassion and caring and the profession. It doesn't go unnoticed that the theme repeated itself, that everybody chose to speak about those different things. Okay, as I have the privilege of calling out our graduates' names to come across to be pinned, they were each told that they could select one person in their lives to come across so that they could pin with them. That's really not fair. It takes a village, right? It doesn't take just one person, but for the sake of getting everyone up here in safety, we could only pick one person. So please know that some of them may have wanted all of you to be up there with them today. And then there will be a slide that they also prepared to be shown as they walk across. Ooh. Do you want to come over on this side? You can stand over here. Okay, there you go. All right, here we go. Nicholas Abella, pinned by his wife. Cassie Acevedo, pinned by her fiance. Ebony Andrews, pinned by her mother. Nicole Andrews, pinned by her mother. Jordan Buchanan, pinned by her son. Raina Burmaster, pinned by her daughter. Marcy Fink, pinned by her mother. Rashida Gotcha, pinned by her sister. Kaylin Guevara, pinned by her mother. Maya Jansen, pinned by her mama. Shantae Johnson, pinned by her mother. That's okay. We'll go with that one. That's okay. I can go with that next one. Is it? Okay, here we go. Amanda Casper, pinned by her daughter. Lena Camedo, pinned by her husband. Rochelle Klotke, pinned by her dad. Trung Lee, pinned by her sister. Lydia Magarado, pinned by her spouse. Mahad is not here with us tonight, but we can clap for Mahad as well. Nicole Moore, pinned by one of our faculty members. Joshua Andera, pinned by his partner. Fred Asango, pinned by his friend. Felice Reagan, pinned by her husband. I gotta switch. Anna Peterson, pinned by her mom. Elizabeth Rasmussen, pinned by her dad. Lily Rivers, pinned by her partner. Nicole Ross Pagankoff, pinned by her husband. Tatanji Violet Nagua, pinned by her son. What? Okay, are you ready? Okay. Oh. Ross. Now he's got me kind of psyched out about this. Zaneba.
Rachel's going to sing it perfectly. That's why. Thank you.
It is with great pleasure that I welcome the graduating class of fall 2023 from North Hennepin Community College. Please stand up and show your appreciation. Now we will move on to the Nightingale Pledge that will be led by our student, Anna Peterson.
I'm gonna need to read a little bit. Can I have just a little tiny bit more light than that up here? Okay. Yeah, thanks. Thanks, that's perfect. Or flashlight is fine. I'm really ready. Friends and family, a tradition when welcoming new nurses into the profession is a pinning ceremony. At a pinning ceremony is to speak a pledge together. The Nightingale Pledge is an adaptation of the Hippocratic Oath for nurses. It honors the work of nursing and those who we will care for, joins us together with those who have walked ahead of us. The pledge is named in honor of Florence Nightingale, like Nicole shared earlier, the founder of modern nursing, who championed nursing as a science, an art, and a profession. We share this pledge as a commitment to our profession. And so I ask all of my fellow nurses to stand. You already got that. You got the lights memo too, y'all. Good work. Here we go. All right. Any other nurses in attendance, you're welcome to join in with us. In fellowship with the nurses here joined, with respect and gratitude for those who have served before me, and in faith with those who will follow, we make these promises. It's in your program, nurses. I commit to nursing as a healing profession. I will use the science and art of nursing to improve functioning, alleviate suffering, and promote wholeness and integrity of being, whether cure is anticipated or not. I will honor the nurse-patient relationship as the locus for healing and enter into it unreservedly while maintaining boundaries that respect privacy and foster trust. I will maintain the ethical principles of beneficence, non-maleficence, fidelity, and veracity, guarding the patient's right to autonomy and seeking justice for all in my care. I claim the same duties and rights for myself as a condition of our common humanity. I will collaborate with all team members to deliver the highest quality of care possible, assuming and delegating tasks responsibly, observing, assessing, and evaluating the patient's response in order to guide and revise the plan of care. I will use technology mindfully, never forgetting that I am the primary and ultimate vehicle for assuring the patient's safety. I will work for social justice and equity, opposing systems that support disparities and structural inequalities, and seeking to identify and eliminate my own implicit bias. I will endeavor to mentor even as I continue to learn, to grow, and to share in the advancement of the profession I love. Thank you. Cohort friends, oh, we're clapping. Cohort friends, thank you for all of the laughter, support, drive, creativity, and community you have shared over the past 3 semesters. You are a brilliant and kind group of humans, and it is an honor to become a nurse alongside you. Congratulations. With joy, the fall 2023 cohort of nurses. Thank you all for joining us tonight to celebrate and support your new graduate nurses. Celebrate them well. They have earned it. Please join us, if you will, for refreshments in the lobby.
Hey, if you got heels, you gotta go to the back.
I want you on.
Hey, if you got heels, you gotta go to the back. If you got heels, you gotta go to the back.
What is happening? You're literally like covering my face.
Hello?
Yeah, Nick.
Graduated?
Nick.
You have a picture?
You need to go to the front. No. Yes, you do.
Sit.
Everybody in there? Right there.
Nicole in the back can't be seen at all.
Pull in the back.
There you guys. Oh,
I got my lighter. I mean, I'm not.
The what? The who? The mic? What? Please come on down.
Ready?
Yeah, oh yeah.
Everywhere. Straight.